My name's Diane Wilkinson, and just briefly, I did an MBSR programme quite a number of years ago now, and as soon as I finished it, I got on with the practices, and I thought, brilliant, this is really helping my up and down and my anxieties and stress, particularly in work. And so I went into my organisation and said, I'd really like us to start some mindfulness, and they looked at me as if I was off the wall. And I thought, okay, maybe I need a bit more evidence towards this. And one of the people, Jill Shepherd, was on the programme with me, and she said, you need to go to the University of Aberdeen and go to Samilin and get yourself on the degree programme. And I thought, a degree? Can I do a degree? And so that's what I did. So it was like 8-week programme, 3-year degree. That was kind of a fast journey. And that's the way I kind of drive my car, actually, and drive my life. So for my research, I decided that I would explore the retention and impact of the practices from the MBSR programmes that the employees for Leeds Community Healthcare Trust had done. And at that time, I was the Organisational Development Support Staff Lead. They always have long titles in the NHS. And I thought, right, this is my opportunity to introduce mindfulness. So I introduced the MBSR programme, commissioned the programmes, and set it running. And actually, I believe these courses are still running today. As Bea stated, the challenge comes after the MBSR to motivate, make time to practice, and to implement learning. And so it was my challenge as the support staff lead to evaluate what happened to the delegates after these programmes. So my research was based around this. The research participants made up 33% of the delegates that had come on courses between 2014, October 2014, and July 2017. So there were 5 cohorts altogether, and they all had 12 delegates on each. They were from different roles, different backgrounds, and different services within the organisation. The methodology that I used was a mindfulness-based inquiry designed by Benton Shapiro from 1998. And I felt that with those 4 aspects of critical social science, phenomenology, Buddhism, and hermeneutics, that I would get much data of experiences, opinions, and feelings from people, which is what I was really wanting, the kind of qualitative data. When comparing it to the literature, I just thought this would give me quite a lot of different data, but actually there wasn't a lot of literature out there at that time. So I did a survey monkey around my 24 delegates who had all consented, and I'd also, as Sheila suggested, had to go through the NHS ethics, which was a process in itself, actually, which was strange because I was actually looking at staff rather than patients, but they said it was a kind of knock-on effect that the staff would influence the patients, and they actually did. So my survey had 15 open-ended questions, and I also used quantitative data from the course reviews from the course provider. And my questions were things like, what practices have you continued regularly? What motivates you to practice? Why do you find it difficult? And how do practices help you? So they were quite straightforward, quite simple questions that we all ask ourselves when we've done our meditations. The interview questions, the 3 semi-structured interviews that I did, actually probed a lot deeper and brought out a lot of categories for discussion. too many really, and it kind of gave me different avenues to go down. So I did a comparison looking basically at my questionnaire questions, and I drew out some themes from that. And the findings showed that most people preferred the 3-minute breathing, which shocked me actually, because I thought of all these lovely practices, loving kindness, compassionate self-break, and 3-minute breathing, well, it's so quick. But actually what they said was, it's really good because we can just stand at the front of the meeting door and do our breathing, just for a few minutes, maybe 5 minutes. And most of the delegates actually loved the 3-minute breathing because they said it gives us a little break in between tasks and in between phone calls. So I was really surprised at that. Those that were actually on the courses a bit longer, they used the sitting meditations and the body scan. And some of their comments were, the daily routine has really helped me to increase my well-being, but it did take me nearly a year to get into it and it was very hard. I now accept myself and my situations. I can't change what happens to my patient. I have to accept I've done my job. Now I have to let go of that situation. And that really freed up a lot of the staff, that they've done as much as they can do and maybe a bit more besides, but they can't do any more. And it actually helped them to not get into a stressful cycle. Another participant said, I have accepted I've done my job, I now get better sleep at night and I can function better. I let go of work and I have more patience for my family. Although the courses were offered for support staff, a lot of the managers actually asked for places on the courses and they became part of my research participants. 49% of them had a daily routine, which they started after their course and continued. And I do know that some of them are still continuing. 39 saw mindfulness as a tool. And one of the categories was a debate between a tool and a journey, a spiritual journey. The rest of them either forgot to practice, or they felt it didn't help them, or they didn't answer my questions at all. And it was like 4%, 4%, 4%. I should have shown you that before, actually. So to conclude then, there were many categories that were highlighted, and I broke it up into individual and organisation. So for the individuals, they really felt that carrying on their practices was quite difficult, but it helped them to change their habits, and as they went over time, their habits began to change. It reduced their procrastination, and some of them felt it was a useful tool to pick up and put down. Others really wanted it to embrace into their religious faith and use it as a spiritual journey. For the organisation, it was recommended that it was introduced into their leadership and OD strategies, and also into their team retreats. The other categories that I looked at, like the spiritual journey and the tool and teaching mindfulness, I think there are other things that can be explored in other research. So I'd like to conclude actually with a quote from Kabat-Zinn that I feel sums up what my research was all about. To continue our practice is to nourish our lives, work and world, moment by moment, day by day. And McCowan et al. 2011, to help navigate further to a more embodied place. Thank you.